Gentlemen, can I ask you something most men over 60 think about but don't say out loud? Do you wake up feeling like your strength is fading? Energy just enough to get through the day? Does intimacy feel less reliable, so you avoid closeness because you don't want to disappoint your partner? If that's you, stay with me. What you're feeling isn't a life sentence. It's a signal, and the answer may be far simpler than you expect. A 60-second daily reset on a small, overlooked spot that can wake up circulation, calm tense nerves, and remind your body how it's supposed to work. I'm Dr. Thomas Carter. I've spent 3 decades helping men restore confidence the natural way. Today, I'm going to show you where this spot is, why it matters, and exactly how to work with it safely so you can bring strength and steadiness back into your day and your nights. Section 1. It's not just age, it's the system getting tight. Here's the pattern I see every week. A man in his late 60s sits down in my clinic. He looks healthy. He walks daily. He takes his vitamins. But he leans in and admits, "Doc, things just don't work like they used to." We blame age because that's the easy story. But the real story is blood flow and tension. Decades of sitting, years of stress, a slow drift in hormones. The pelvic floor, the set of support muscles that manage urination, erections, and core stability, becomes tight and weak at the same time. Imagine a rubber band left stretched across a jar. It looks taut, but it's lost its snap. When that happens, a few things follow. Circulation slows. Fresh blood in, stale blood out, both get sluggish. Nerves get pressed in all the wrong places, so signals turn fuzzy. The body leans into fight or flight, keeping vessels more constricted than they should be. Result? Less sensation, less consistency, less confidence. Not because you're broken, because your system needs a reset. Section 2. The overlooked switch. There's a small area of tissue between the scrotum and the anus, the perineum. Some traditions call it the $1,000,000 point. I know, not dinner table conversation, but anatomically, it's a strategic crossroads. Vessels that feed the tissues you care about run directly through this region. Nerves that carry pleasure and performance signals pass over it. It sits just beneath the prostate and anchors the root of the penis. When the tissue here is tight, everything downstream stiffens and stalls. When you gently stimulate the area, you help move stagnant blood out and invite fresh, oxygen-rich blood in. You also cue the nervous system to switch from fight or flight to rest and rebuild, the mode where natural responses happen. I've seen men try every gadget and pill. Then they spend 1 quiet minute a day on this point and say what my patient Robert, 68, said after 2 weeks. "Doc, it feels like my body remembered." Section 3. What's actually happening inside. Let me break it down without the medical exam. The pump effect. A slow, rhythmic press and release acts like a manual pump. You move sluggish blood out, pull fresh blood in. More oxygen, more nutrient delivery, better waste removal, less congestion. Decompression for nerves. Tight pelvic tissue can pinch nerves much like a poor-fitting shoe irritates a toe. Gentle stimulation eases tone in the fascia and muscle, giving those nerves a clearer pathway. Signals become crisper. The prostate neighbor benefit. Because the perineum sits under the prostate, improved circulation here often supports a calmer, less irritated gland. Many men notice steadier urinary flow and fewer nighttime trips. The brake pedal for stress. This practice nudges your parasympathetic system, the part that slows heart rate, relaxes vessels, and opens the door for natural performance. Think exhale rather than bracing. No pill can do all 4 of those at once, but your hands can in 60 quiet seconds. Section 4. The exact 60-second routine, safe and simple. Position. Option A, sit at the edge of a firm chair, feet flat, shoulders relaxed. Option B, lie on your back with knees bent and feet on the floor to soften the lower back. Find the spot. Use your index and middle fingers. Locate the midpoint between the scrotum and the anus. You'll feel a slightly softer, tender area. That's your target. Pressure. Think like testing a ripe tomato, firm enough to feel, never sharp or painful. If you hold your breath, you're pressing too hard. Timing and patterns. Choose one to start with. Pattern 1, circles, 30 seconds clockwise, 30 seconds counterclockwise. Pattern 2, press and release. Press for 5 seconds, release for 5 seconds, repeat for 60 seconds. Pattern 3, gentle pulses, a slow up-down rhythm for 1 minute. Breathing. Inhale through your nose for 4 counts, exhale through your mouth for 6 counts. Exhale longer than you inhale. That's your built-in calm switch. How it should feel. Warmth, ease, maybe a subtle sense of space or tingling. No sharpness, pinching, or lingering soreness. If you feel any, lighten up or stop for the day. Frequency. Start once daily for 60 seconds. After 2 weeks, you can add a second short session if you like, morning and evening. If you're finding this helpful, tap like so more men can see it, and tell me in the comments where you're watching from. Healthhub is about community, men helping men, one small habit at a time. Section 5. The Oil Advantage. Optional, but powerful. You can do this dry, but the right oil increases comfort and adds therapeutic value. Here are 3 options I recommend. Castor oil, deeply penetrating, naturally soothing. Many men feel gentle warmth afterward. Virgin coconut oil, light, clean, skin-friendly, great for sensitive skin. Black seed oil, more premium, often reported to support circulation and overall vitality. Optional enhancement, add 2 to 3 drops of peppermint, circulation, or rosemary, vitality, essential oil per ounce of base oil. More is not better. Keep it light. Blend suggestion? Half castor, half coconut as a base. Store in a small bottle near where you do the practice. Section 6. Timing is the multiplier. The technique matters, so does when you do it. Morning. Prime the day. Right after you wake, before screens and stress. You'll notice better clarity and steadier energy. Evening. Downshift. 20 to 30 minutes before bed to quiet the system, ease tension, and support deeper sleep. Consistency beats intensity. 1 minute daily for 30 days outperforms 10 minutes once a week. Section 7. Common pitfalls and easy fixes. Pressing too hard? This is finesse, not force. Lighten up until the breath stays smooth. Rushing the clock? Set a 60-second timer and let yourself finish. The last 15 seconds often feel the best. Bracing your jaw or shoulders? Scan your face and drop your shoulders on every exhale. Expecting fireworks on day 1? You're coaxing a system, not flipping a light switch. Look for steadier mornings, fewer nighttime bathroom trips, a calmer baseline, improved reliability over weeks. Section 8. What men report. beyond the obvious. When blood flow improves and nerves feel less compressed, the benefits ripple. Fewer urgency episodes and a steadier stream. Less hip and low back tightness from constant clenching. Better workout recovery and walking endurance. Quieter mind, brighter mood, more patience. A sense of, I'm in the driver's seat again. And for many, improved intimacy is not a single dramatic moment. It's a return to reliability, quiet confidence, less worry, more presence. Section 9. Lifestyle pairings that multiply results. A 1-minute practice gets stronger when the rest of your day supports it. 3 simple pairings. Walks that shake out the hips. 10 to 15 minutes, hips loose, arms swinging. Think of it as rinsing the pelvic area with fresh blood. Breathing that lengthens the exhale. Try 4 in, 6 out breathing anytime you're stressed. Longer exhales tone the calm pathway that keeps vessels relaxed. Evening blue light taper. Dim lights and set a screen curfew 45 to 60 minutes before bed. Good sleep is the hormone glue that holds progress together. Nutrition note. Hydrate through the day and get magnesium-rich foods like pumpkin seeds, almonds, and spinach. Hydrated, mineral-supported tissue responds better to gentle massage. Section 10. Safety notes. Read this. Skip the routine during active infections, recent pelvic surgery, or if you have severe hemorrhoid flare-up or unexplained pain. If you're on anticoagulants or have a bleeding disorder, talk to your clinician first. If anything feels sharp or wrong, stop. The right sensation is warm, easing, and calm. Section 11. A 30-day challenge. Print this simple plan and tape it where you'll see it. Week 1, 60 seconds every morning. Week 2, keep mornings, add 60 seconds before bed. Week 3, keep both, add a 10-minute walk after your morning session. Week 4, keep everything, track wins. Fewer night trips, clearer head, steadier confidence. By the end of 30 days, most men don't need to be convinced. Their body convinces them. Section 12. The Quiet Victory. I'll leave you with Robert again. He came back after a month. He didn't brag, he smiled. Doc, my wife noticed before I did. That's how this often feels. Not loud fireworks, but a steady return of something you thought was gone. Strength without strain, calm without apathy, reliability without fear. You're not broken, you're responsive. Give your body the right nudge and it responds. If this helped, share it with a brother, a son, a friend. Drop I'm in the comments if you'll try the 30-day challenge. And subscribe to Healthhub for more simple, science-backed ways to reclaim strength after 60. I'm Dr. Thomas Carter. Stay steady, stay strong, and keep going.